Hi, I'm Dr. Creighton. Right now we're about to go and see our patient Hannah, and we have to give her some serious news. She has hematologic disease of the newborn, which is HDN. It's an incompatibility between the blood types of the mother and baby. Hi Hannah, how you doing today? Good. Go ahead and take a seat for me. It's nice to see you again. Okay, Hannah, we just got your blood work back, and everything I'm about to explain to you is going to be stressful, but feel free to ask questions and allow me to answer anything I possibly can.
What is it, doctor?
Okay, Hannah, so basically you have the hematologic disease of the newborn, which is HDN. It's an incompatibility of either your RH blood types or an ABO incompatibility. You happen to have the RH incompatibility. In other words, you are an RhD negative and you have become pregnant with an RhD positive child mainly because your husband carries the D antigen.
Is this common?
Okay. Well, HDN is relatively uncommon. It usually affects approximately 4,000 babies in a year in the United States. However, Hannah, since you have already had a baby before, this unfortunately is kind of common during a mother's second child. I'm going to do my best to give you the play-by-play of everything that's going to be happening during your pregnancy. We're going to have to track the fetus because it requires very intense monitoring. Mainly we want to check for signs of anemia and fetal hydrops, which can be very serious.
What else do I need to know about my pregnancy?
Well, what's happening is during your pregnancy, since you're the mother, your antibodies are transported across the placenta and therefore they're entered into the fetal circulation. The newborn's red blood cells are RBCs and they're being attacked by your antibodies. In other words, the attack begins while the baby is still in the womb, which is now, and it's caused by the incompatibility of your blood and the baby's blood.
Wait, so how did this happen again?
As I said before, pregnancies at risk of HDN are those in which the RhD negative mother becomes pregnant with an RhD positive child. The child has inherited this from your husband who carries the D antigen.
What's going to happen when I have the baby?
Well, unfortunately, Hannah, every baby experiences symptoms differently, so it's a little hard to tell right now.
I'm scared, doctor.
All that's going to happen, Hannah, is during your pregnancy we're going to have to watch for certain symptoms. With amniocentesis, we're going to have to look for a yellowish coloring in the amniotic fluid, and possibly it may contain blip. Right, Hannah, right now I'm going to take an ultrasound.
What's the ultrasound going to show?
Alright, Hannah, in the ultrasound, we were just looking for an enlargement in the liver and spleen to see on the fetus, and also an enlargement of the heart or possibly a buildup in fluid in the fetus's abdomen.
What's going to happen to the baby when she's born?
Well, Hannah, just like we're monitoring you right now during pregnancy, when the baby's born, we're going to have to monitor the baby as well, extremely closely too. We're going to have to look for symptoms of possibly jaundice, and the baby could have severe edema, which is swelling up the entire body. The baby could also be extremely pale when it comes out, and unfortunately, babies often have times with breathing, but we will make sure it's on oxygen right away, so it's nothing to worry about right now.
Oh my God, what's going to happen?
Well, Hannah, when the baby is born, if it does have any of these signs, we are going to need to do a blood exchange transfusion. Basically, this is going to replace the baby's damaged blood with fresh blood. Like I said, Hannah, I know this is a lot to take in and it may seem very stressful right now, but we are going to get you and your baby through this.
Thank you, doctor. I really appreciate it.
No problem. For a quick recap, just in case you missed all of that, pregnancies at risk of HDN are those in which the RhD negative mother becomes pregnant with an RhD positive child, the child having inherited the D antigen from the father.